in 1925, it already has a history of 96 years with a third generation of grandchildren. A grandson of Tokujiro, Takashi Namikoshi, chairman of the International Shiatsu Foundation, is now to educate people all over the world about the global standard of true shiatsu. His shiatsu salon is located on the Imperial Hotel Plaza in Tokyo. We will celebrate the 100th anniversary in 4 years. A shiatsu literally means to press with fingers. Shiatsu, we use only hands, mainly the thumbs and palms. The basis point to learn shiatsu and its golden rule is that we do not use either elbow or knee. Our shiatsu permits the pressure in the inner deep of the muscle with comfort, promote the nerve, vessels, veins, and endocrines to normalize that vital function by pressing over 660 basic anatomical points. There are 7 characteristics of shiatsu: immediate diagnosis and therapy, using only fingers and palm, no side effects, no age limit, health barometer, increasing in conjunction with the development of trust, treatments for the whole body. There are also 7 physical effects of shiatsu: revitalizing the skin, limbering the muscles, stimulating the circulation of the body fluid, regulating neural functions, balancing the endocrine system, and balancing the skeletal structure, and regulating the alimentary system. Contraindications are contagious illness, high fever, immediately after surgery, extremely physical weakness, infectious skin ailments, leukemia, and cancer. Shiatsu should be started with patient laying in the lateral side position at first, then second in the prone position with face down, and switching to the supine position with face up. Lateral side position targeting on anterior and lateral cervical region of the neck, upper trap of the shoulder, and lumbar region of the back. Prone positioning targeting on the head, neck, shoulder, back, hips, and legs. Head and neck are focused on occipital, medulla, posterior cervical region, and shoulder and back are focused on suprascapular, interscapular, infrascapular, and lumbar region of the lower back. Hips and legs are focused on iliac crest, sacral, glute, hamstring, calf, and bottom of the foot. Shiatsu must always begin with the left side of the body, then should repeat on the right side. Shiatsu pressure is mainly a pressing, operating to promote arterial blood. It is also performed by pressure that penetrates deep muscle with vertical pressure and continuous pressure. In standard pressure, the most widely used method, pressure is applied gently and gradually increased, and it's then gradually decreased. Application is one phase and lasts from 3 to 5 seconds. There are 5 stages of pressure level: touch, slight, light, medium, and stronger pressure. Medium pressure intensity level is most likely between 5 to 15 kilograms. And stronger pressure intensity level is up to 30 kilograms. There are 6 kind pressure application: thumb pressure, 2-digit pressure, 3 fingers pressure, pressure with open thumb and 4 fingers, pressure with 4 fingers held on, and palm stimulation pressure. The combination of an orderly, regulated lifestyle in observance with the following 5 rules and periodic shiatsu will help to live a long and healthy life. 5 basic rules of long life and good health are proper diet, proper sleep, proper passage, proper exercise, and laughing. As Tokujiro Namikoshi saying that laughter is the gate to happiness, and the laugh rejuvenates from ages. A supine positioning targeting on the top of the head, face, legs, arms, hands, and abdomen. Top of the head and face are focused on median line, temple, nasal, zygomatic, and orbital region. Legs are focused on quads, anterior tibial region. Arms are focused on armpit, upper arm, forearm, palms, and fingers. As I mentioned before, pressure must be applying comfort with vertical and continuously. Now, International Shiatsu Foundation is to educate people all over the world about the global standard of true shiatsu. At the same time, we want to offer our knowledge to people so that they can reach their 100th birthday in good health and increase mankind's overall life expectancy. That is why we recommended that receiving shiatsu at least 60 minutes once every 2 weeks. At last information, becoming the shiatsu therapist in Japan, after study and train about 3,000 hours for 3 years at an institutional school, and it is necessary to pass the national examinations. Finally, finishing a shiatsu on the abdomen. There are 9 points applying pressure when pressing the abdomen using the combination pressure, starting with palm stimulation pressure, then 2 fingers pressure. Start at upper stomach or epigastric fossa and move down to small intestine. Keep moving down to bladder area. Move left side on cecum. Move up to the liver. Move right side to spleen. Move down descending colon. Continue to down on sigmoid colon. And finishing on rectum. Now we are finishing a general whole body shiatsu therapy.